Good morning, everyone. Thank you for joining us. It is with an extreme sense of deja vu when I say that I know everyone's anxiety levels must rise when you hear the words unscheduled media briefing. But our intention is only ever to keep you informed and to keep everyone in Newfoundland and Labrador safe. In a few moments, Drs. Fitzgerald and Haggie will update you first with the news that the entire province will be moving to Alert Level 3 later this evening, and then share news on the continuing arrival and rollout of boosters and ramping up of mass vaccination clinics. Our team is working incredibly hard to get those doses out where they are needed as soon as possible when they land in the province. So please continue to be patient and be kind. Your kindness now to everyone you encounter is more important than ever before in this pandemic. Please know that none of us on this panel want to be here right before the Christmas season. And we know the public health measures are tough, and the rising threat of Omicron is disheartening for all of us, especially after all we've been through and during this special time of year. I know we are again asking people to dig a little deeper and find the energy and the fortitude to help us all face what we are up against. But I feel like we are already doing it. I see that in the overwhelming number of inquiries regarding those booster shots. Just days away from the holiday break, I know the timing couldn't be worse. And in the spirit of the season, health is one of the best things you can all wish for. So let's embrace that, and let's do our part. Please listen, remind, and reinforce those public health measures. Keep distance, mask up, wash your hands, and keep your contacts low. Stay at home if you feel sick. Get tested if you have a symptom. And please arrange to get your booster shot. I know that will require some patience, but trust us as we continue to ramp up and accelerate the delivery of those vaccines. Your actions today will certainly make incredible impact tomorrow. On behalf of all of Newfoundlanders and Labradorians, let me provide a direct message to our frontline healthcare providers. We know you've been through one heck of a year, and you're exhausted, tired, fatigued. We know that you're doing your best in these trying times, and please know that we are all here to support you and cheer you on as you look after all of us. So please keep up the hard work. With that, I'll turn things now over to Dr. Fitzgerald for an update on today's numbers and new measures that are being implemented. Dr. Fitzgerald.
Thank you, Premier. Thank you all for joining us today. Since the last media advisory yesterday, we have 60 new confirmed cases of COVID-19 in the province, all of which are under investigation at this time. 37 cases are in Eastern Health, 10 are in Central Health, 12 are in Western Health, and there's one case in Labrador-Grenville Health. There have been 12 new recoveries, leaving 223 active cases in the province. No one is hospitalized as a result of COVID-19, and 3,458 tests were completed since yesterday, with over 365,000 tests completed to date. We now have active outbreaks in Western, Central, and Eastern Health, and our active case count has jumped from 30 to 223 in 1 week. Thankfully, right now, we have no hospitalizations due to COVID, but we are carefully monitoring what is happening in other jurisdictions that are further ahead in their Omicron outbreaks in an effort to gauge what to expect in terms of disease severity. We are cautiously optimistic, but it is still too early to draw any conclusions. Our fear is that if we start to see severe illness, it will overwhelm our healthcare system, which is already stretched. And we are pulling healthcare staff from other areas to work on COVID response, and we cannot risk a surge in hospitalizations. If our hospital capacity is taken up with COVID-related illnesses, that means we have less capacity to care for those with non-COVID, urgent, and emergent health issues. Our daily case count has remained steady over the past week. However, we do anticipate it will rise given how infectious Omicron is. How rapidly and to what extent our case counts rise really depends on how careful we are during this critical period. It gives me no joy to say that we have made the difficult decision to move the entire province into Alert Level 3, effective midnight tonight. Under Alert Level 3, weddings, funerals, burials, religious and cultural ceremonies are limited to 100 people or 50% of venue capacity, whichever is less. Public visitations are permitted with one household bubble visiting at a time, and wakes are prohibited. Performance spaces, cinemas, and bingo halls are closed. Fitness facilities, swimming pools, arenas, and dance studios are permitted to open with a maximum capacity of 100 people or 50% capacity per room or ice surface, whichever is less. Physical distancing between households must be maintained. Restaurants are open at 50% capacity with physical distancing. Bars and lounges are closed. Amateur sport and recreation activities are limited to team practice and training only. Competition and training with other teams, even within the association, is not permitted. And informal gatherings, such as those in the home, are limited to your household's steady 20. We ask every household to have no more than 20 close, consistent contacts. Anyone that is medically vulnerable and older individuals should be extra cautious, especially those that have not had their COVID-19 booster. If you fall in this category, limit your contacts to your close friends and family that you usually spend time with. With regard to travel within the province, we recognize that this is an important time for families to be together, and we know that students will be returning to their home communities, and you may have loved ones that need support during the holidays. We also recognize that some families may travel to their cabins or cottages to other areas of the province over the holidays to celebrate Christmas. Travel for these reasons is acceptable, but please stop and consider if your travel is essential or necessary. If you must travel, please be cautious and keep your contacts low. You should not be traveling to another area of the province to have a party with people who are not in your close, consistent 20. The more movement of people we have within the province, the more spread of the virus we will see eventually. And we strongly recommend that employers support employees to work from home where possible. If we can get everyone's support in adhering to these measures, it will help to alleviate the pressure on our healthcare system and preserve capacity to deliver vaccinations, respond to COVID outbreaks, and treat all non-COVID-19 health concerns. Our public health teams are very tired. They've been really working tirelessly, even during periods of low prevalence of COVID, and we really need the whole public to support our teams right now and to try to reduce their contacts. It's the most important thing that you can do, along with staying home if you're sick. The last thing we want is for people to think the work we have put into the last 2 years is all in vain. We benefited from a largely favorable epidemiology and very few restrictions compared to other jurisdictions. But most importantly, we saved lives. Today, we need to face things as they are, not as we want them to be. We will reassess where we are on January 10th to determine if we can change the alert level. I know there is significant demand for booster shots right now. Please have patience while pharmacies, clinics, and regional health authorities schedule appointments. We will have enough supply for everyone who wants a booster. Please also remember that it takes 14 days for your booster to give you maximum protection. Please do not schedule a booster dose before you have reached at least 22 weeks past the completion of your primary vaccine series. So for most of us, that's after your second dose. Those administering the vaccine are not permitted to administer it before you reach 22 weeks. In the weeks ahead, more people will receive a call or a letter from public health to advise that they have been in close contact with a positive case. These are what we refer to as high-risk contacts because the nature of the exposure means they have a higher risk of getting COVID-19. For example, if you attended an informal gathering in a home where there was no masks worn and no distancing, you would be a high-risk contact of a case there. High-risk contacts have more stringent testing and isolation requirements. If you found out that you may have been exposed to COVID-19 through a public exposure notification, or if you were contacted by a business to let you know that you may have been in the same place as someone that tested positive, you would not be considered a high-risk contact, and those individuals should book a test, but are not required to isolate unless symptomatic. We have a self-isolation tool online that will help you determine your requirements based on how you were notified. Please remember that 811 cannot tell you self-isolation requirements. Public health will give you specific guidance if you are a high-risk contact. If you are uncertain what to do, use the self-isolation tool. We need to preserve 811 capacity for those that need health advice from a registered nurse. We issue public exposure notifications for settings where the risk is higher, for example, bars and restaurants, where people would remove their masks to eat or drink. But make no mistake, COVID can be anywhere. Even if you have not been exposed to COVID-19, if you have one symptom, you should assume it is COVID, stay home, and book a test. If your test is negative, stay home and away from others until your symptoms resolve. This is our last media availability before Christmas, and we have heard it said many times that COVID-19 does not take a holiday. That means public health will be working throughout Christmas on swabbing, testing, case investigation, and contact tracing. So if you have interactions with public health staff, please be kind and patient with these people that are working through the holidays to help protect you and your loved ones. To our staff in the regional health authorities and here in the department working quite literally around the clock on COVID response, I want you to know that I have the utmost gratitude and respect for your dedication. We could not have come so far and fared so well without all of you. To everyone across our province, this may be another different Christmas, but I hope that you and your loved ones can find peace and happiness. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I certainly echo those comments that all the hard work has not been in vain. We do have a good vaccination rate, and that we just need to act now. It's too late to act 2 weeks or 3 weeks from now when things may have gotten out of control. So with that, I will turn things over to Dr. Haggie for some brief comments. Minister?
Thank you very much, Premier, and I'll start where you left off. I spoke with the CEOs of the regional health authorities over the course of the last 12, 14 hours, and amongst other topics, stressed that we were in a relatively good place compared with other jurisdictions to face what's coming. Given the rise in case numbers, the change in alert level for the whole of the province is a sensible, proactive measure. Given the time of the year and the fact we're all now kind of in the same boat, the comments that Dr. Fitzgerald makes about travel are especially helpful. It balances family reunification and public health in a way we probably would not have been able to do had we not done as well through the efforts of public health and yourselves over the course of the last 2 years. I have, through the CEOs, extended my own pride and thanks to the public health and frontline healthcare workers who have stepped up repeatedly over the course of the last little while. In terms of other changes, Dr. Fitzgerald referenced the rollout of the boosters. We have 214,000 booster doses of Moderna in the province and available. And our challenge now is simply painting clinics and appointments faster than people are booking them. It's great to see that demand, but it is a challenge to rise to that. The regional health authorities have very clear direction to pivot to focus on booster administration and to get these into arms. Pharmacies across the province who participate in the COVID vaccination submit their requests for a volume, and these are being met and will continue to be met, and there is margin if they need more. So again, they are another route. Equally, we have a number of physicians who are giving COVID shots and COVID boosters, and they may be yet a third route. Given the comments that Dr. Fitzgerald's made, I just want about assessment and online services. The place to go for information, good, high-quality, accurate information, is the website. 811 is there solely for those individuals who do not have internet access, and 911 is not at all appropriate for these kind of questions. Those are for emergencies only, and unfortunately we have seen people calling those inappropriate, and I would encourage you to use the website. From the point of view of government employees, the deputy ministers and executives in Crown corporations are being told to, wherever possible, allow their employees to work from home if their job can be satisfactorily done from home. If not, then they will come into work. Along with the other measures that were announced, this work from home policy will be revisited on January the 10th. The details for the employees concerned is being worked on today and will be rolled out over the course of the next 24 hours or so. So I think with that, again, I would pause, wish people a happy holiday, Merry Christmas, if that's your tradition, and stay safe. Thank you very much, Premier.
Well, thanks, Minister. I'll now invite questions from the media.
Thank you, Premier. Today we have 7 reporters joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask one question and one follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask one final question. Our first questions today are from Richard Duggan of the OCM. Please go ahead.
Thank you. Dr. Fitzgerald, you said that we're dealing with outbreaks in Eastern, Central, Western Health. Can you tell us about the epidemiology that we're seeing in these outbreaks? Are these cases that are coming from, say, events that were held, from travel? What do we know?
Yes, so certainly, we've had cases related to travel, and we've had some of those cases that have not had any onward spread, which is great. Unfortunately, we have had situations where we've had outbreaks as a result of presumably somebody who traveled who went to one of those gatherings, or someone who's around someone who traveled who was positive. So, and we have had several workplaces as well as parties and gatherings where we have seen outbreaks and pretty high attack rates as well in those gatherings. And we're seeing that in all the regions at this point. So, that's why we felt it was necessary really right now to try to get out ahead of this with the Alert 3.
Do we know how many cases of Omicron we have in the province right now?
As of this morning, we had, oh my gosh, I've forgotten.
63.
64 cases of Omicron that we have. Those are either confirmed or presumptive. But at this point, except for a few contacts of the Delta cases that we had in Western, right now we're assuming anything that's coming up is Omicron.
Our next questions are from Renelle Legros with All Newfoundland and Labrador. Renelle, please go ahead.
This is sort of a follow-up to a question I asked on Sunday. I'm just wondering how difficult it was to bring in these new restrictions. Given tomorrow's Tibbs Eve, it's a day many businesses bring in a lot of revenue to carry them through the winter months. This is no doubt difficult news for them today.
As I think we all said in the comments, I'll pass it over to Dr. Fitzgerald, none of us want to be delivering this news. We do think it's the right time to introduce these measures in order to hopefully protect the economy long term. It may be some short-term pain. It's not ideal timing, but COVID doesn't know that it's Tibbs Eve or that it's Christmas Day. So this is an important measure right now, given how fast it's moving. Look, the evidence is still evolving from Denmark and the UK and other places. So but we just don't have the time, given the doubling rate of this virus that we had before, to be able to look at a body of evidence that has evolved elsewhere as it's actively evolving. So we need to make sure that we're taking the measures that we're taking now, and we've always shown that we're flexible and dynamic in the face of the evolving evidence, and will continue to be. But we are truly empathetic towards those businesses, especially during this time of year, and we'll be there to support them going forward.
And I mean, given what we're facing and the number of cases that we see today, do you think these measures are strong enough to get us through Christmas?
So I think we all know what we have to do to get us through Christmas. There's, it's been shown time and time again that that COVID spreads in gatherings where we, are not wearing masks, where we're spending a lot of time together indoors, and it really spreads when we have lots of contacts. So I think we have to all work towards keeping our contacts as low as we can. And I think, this alert level allows us to do that. It does certainly reduce numbers in larger venues. And I think if we all worked really hard to make sure that we keep our own contacts to that consistent 20 people, then we certainly can reduce the risk. We're going to see more spread of Omicron, I think, than we've seen of any other variant that we've had to date, but I do think that we can certainly we can hopefully not be in a place where we're seeing other places right now.
Our next questions are from Jody Cook with NTV. Please go ahead.
Good afternoon. I'd like to just circle back to what the Chief Medical Officer of Health and the Premier have indicated about this being all in vain. I think if we could just touch on that for a second. I know the public is probably having a hard time reconciling the last 22 months, the vaccines, the passports, the mask mandates, the stay-at-home alert. Do you want to just speak to that again and just remind people why we're here?
Sure, I think we can all tackle that one. But, first of all, vaccines, they're not for nothing, right? I think they do work. We're just unsure of the level of effectiveness of them. So if you're seeing around the world in other jurisdictions, they didn't have as high level as vaccines as us. They're not going to cause. They're still an incredible barrier to the virus. It's just the rate at which this virus spreads has not allowed us to gather a level of evidence that we need to and had to have the time to be able to do less restrictive measures. We're looking around the world and around our own country. We're seeing that doubling rate really kick in the steep part of the curve. And we're anticipating then that will have impacts on hospitals. So even though we have people vaccinated and the boosters happening, it's just the sheer volume will overwhelm the system if we don't take these measures now. We're hopeful that, as evidence evolves in Denmark and the United Kingdom and in Ontario and Quebec, that we will be able to lighten these measures, but we feel like we're in the right spot right now. So everything wasn't done in vain. In fact, we lived a little more freely, as Dr. Fitzgerald said, than other jurisdictions for a period of time. But equally, they're still effective and just the 2 doses are still effective for many people in preventing severe disease. And so these measures are taken right now because in the absence of definitive evidence about how we can more finely tune the public health measures. I think that's safe to say, is it not, Dr. Fitzgerald? Yeah.
Yes, and I think, we need to remember, I'll be honest, I was feeling exactly the same way yesterday, and I said, I feel like, I was talking with our epidemiologist, and I said, I feel like, everything over the last 2 years has been for nothing. And she said to me, no, it's not for nothing. You have to remember, we have saved countless lives with what we've done. And we have, and people have stepped up and they've done what they needed to do. And we went through all that hard work with alert levels, and we really did save lives. I mean, we saw what happened everywhere else across this country, and we have less than 20 people who have died from COVID-19, and we haven't seen a lot more deaths either. So, I think that we have done exceptionally well, and we have worked very hard, and we should be very proud of where we are. But this is just, we want to keep going in that direction. So this is what we have to do. So, I hope people don't feel disheartened, because we really have accomplished something incredible.
Thanks. I just want to go back to what happened on the weekend. I know we all saw the social media posts of people enjoying their Christmas gatherings with friends. George Street was a particularly popular place in the province, and then we saw a couple of days later confusion show up on the exposure list. What timeline are we looking at for really seeing maybe the manifestation of that? The early times, it was 2 weeks. Are we looking at maybe seeing a massive surge on Christmas Day?
Yeah, so what we know about this variant is that it seems to have quite a shorter incubation period, and most people are becoming symptomatic 2 to 3 days after their exposure is what we're seeing right now. So it's moving very fast, which is another reason why it's spreading so effectively. And so I would anticipate if we're going to see a lot from that, we will see it fairly quickly, and that's why we're seeing these just meteoric rises of cases elsewhere in the country. So, you know, it could be that we have lots of cases by Christmas Day. I guess the next 24, 48 hours will tell us.
Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Good morning. What has your experience told you about the last-minute crush of Christmas shoppers? Has that proven to be a typical spreading event from your experience?
People actually Christmas shopping?
Yeah.
Yeah. So at the moment, retail, doesn't seem to be a source. Mainly, I think, because people are wearing their masks for the most part. And the type of interaction that you're having is usually with one particular person is usually quite brief. For the most part, lines tend to be distanced. And there's hand sanitizers before you walk into the establishments. So we don't typically tend to see super spreader events from those venues. Generally speaking, where we're seeing it the most are where people are removing their masks and where, the distancing is not happening. So in those closer social gatherings.
Okay, thank you. And I realize that there's usually a lag time, but can you take? Sorry. I'm sorry. Was someone else?
No, we can still hear you, Peter. Yep.
Okay. I'm wondering whether you take anything from the fact that you still have no hospitalization.
No, at this point we can't. We really can't draw any conclusion from that. We know with this with this disease that from the beginning hospitalizations have lagged about 2 weeks from cases. So we saw a rise in cases, and then about 2 weeks later we see that rise in hospitalizations. And so we're really just a bit too early into this. If it is milder, then it may take a little bit longer for us to see those hospitalizations. What we are seeing elsewhere in the country right now are some upticks in hospitalizations in Quebec and Ontario. So we're watching that very closely. But eventually, if you get enough cases of any disease, because every disease has a certain percentage of people who will develop severe disease. And if you get enough cases, you will end up with hospitalizations, right? So that's what we don't know at this point, and that's what we're trying to prevent with these measures.
So the absolute numbers would be larger.
That's an incredibly important point that I think that sometimes everyone struggles with. It's the volume. So just even though vaccines do seem to work to prevent severe disease, we are taking these measures. It's the volume at which this will create because of the rapid transmissibility of it and because of the doubling time that is what we're concerned about overall here in terms of protecting our hospital capacity and our ICU capacity.
Right. Thank you.
Our next questions are from Terry Roberts with the CBC. Terry, please go ahead.
Hi, I'm just wondering if you don't do what you're doing today, announcing these new restrictions, what's your modeling telling you that might happen in the coming weeks?
So with regard to, there's modeling on a national level that's looking at this, and certainly it's showing that, if we don't reduce our contacts, and some modeling is saying down to 30% of where we were before COVID even, that, even with boostering, it's going to be difficult to control things and to maintain hospital or health system capacity. So it's really important to reduce our contacts. With regard to our modeling, here, thankfully, our case numbers have been low, so doing predictive modeling is not easy when you have low case counts, and they seem to be coming from very localized clusters. So we're relying on what we're seeing elsewhere to see, to inform us about what likely will happen, and it's always held true before. So we think that's a reasonable thing to look at.
Okay, for my second question, you mentioned you're going to reevaluate these new measures on January the 10th, I think is what you said. That's after schools reopen. What early impact might this have on schools and post-secondary?
So I guess time will tell us that. It's difficult for us to predict right now what's going to happen. I think the next 2 weeks, we'll see some we'll get some critical information about a spread and just, how quickly it's spreading and who's getting the disease more so. And so it's, I can't really answer that question right now. I guess it's going to be, we're going to need a little bit more information and a bit more time.
Our next questions are from Heidi Adder with CBC Labrador. Heidi, please go ahead.
Thanks so much. Just to start, Minister Haggie, as your own website says, why are people arriving at the land borders from Quebec into Labrador not being provided those rapid test kits when this is part of the isolation requirement to stop this spread?
The Labrador-West border is being treated differently and has been really since the beginning of COVID, because it really straddles, the communities straddle that border. So people who live and work live in Labrador, work in Fairmont, live in Fairmont, work in Labrador. There is, on any given day, about 700 of our arrivals all come through those points. So it is felt that really and honestly that particular border there is not representative of the borders that we're concerned about, where you see importation. Dr. Fitzgerald's team and public health have a strong liaison with their counterparts in Quebec. We feel the number of people who might take the effort to drive from Ontario or Alberta and go through that border is actually so small as probably to be insignificant. So that's why that border is treated differently.
My second question, we've been told people flying into St. John's from around the country are given rapid test kits, but not that they connect to Labrador, such as here in Goose Bay. We're being told people haven't been receiving them upon arriving in Goose Bay either. Why are those not being provided, and will that be changing?
That's a very good question. I think people coming in from outside of the province should actually receive test kits. That's the purpose of the SMO. Certainly those people who fly, for example, into Labrador and then onto the North Coast, they get theirs in Goose Bay. It's a question that I haven't had posed to me before, but certainly we can go and make sure that potential loophole, if such it is closed.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi. Building off what Heidi was asking, Quebec's lower North Shore, so the other Labrador border, has seen a lot of COVID cases over the last number of days. There are a lot of people who go back and forth between the Straits, the communities in southern Labrador and northern Quebec. Are there any new rules related to that area of the province? And I note also that there was an exposure notice for the ferry between St. Barbe and Blanc just today. Are there any changes related to marine traffic between Newfoundland and Quebec's lower North Shore?
So to this point, we haven't had any changes in that movement. That's an essential service really for those people and an essential way for them to be able to move about. And so we haven't. Once again, as Mr. Haggie said, we have a close relationship with officials in Quebec, and we're certainly we have open lines of communication with them to discuss situations that may be happening. We're watching that area very closely, following up very closely, and certainly some of these exposure notifications happened as people were moving into other areas of the province. So, but we are watching it very closely, and if we need to, to make any changes to those measures, we certainly will. But, it's a complex situation in that these communities are so closely linked to each other on a day-to-day basis. You don't want to interfere with people's normal daily functioning.
And my second question relates to, you talked a lot about surge capacity in hospitals. We've heard that a number of healthcare workers are now isolating. Can you provide that number if you have it? And if we do see problems with capacity in hospitals, where's the situation going to be most severe in terms of the area of the hospital that would be most affected, and other locations in the province where we believe this would be the biggest risk?
From the point of view of the isolation requirements for essential or critical healthcare workers, certainly that's a topic that we have discussed, and the Premier may want to speak to his discussions because we're trying to harmonise our approach across Atlantic Canada, and we've had discussions with the other ministers of health on this. Those recommendations will come forth over the course of the next day or so. As to particular areas that might be more critically affected, I think it's really difficult to say. What we've seen in the past has been the COVID units have, by and large, managed. The ICU capacity, particularly in Central, was a challenge with the clusters around Botwood and Bishop Falls earlier on in the year, and there was a level of cooperation between the regional health authorities which was absolutely stellar, which allowed that workload to be distributed. So those kind of mechanisms exist, and the CEOs have a very open and collaborative approach between them to make sure that they can pinch hit and cover for each other. So I don't know if there's any one particular area, other than maybe the emergency departments where we've seen some challenges in the past. But I think those will be managed better when we get to the point of our newer approach to fully vaccinated staff with boosters and isolation requirements. So that's a work in progress, and Dr. Fitzgerald will be able to speak better to recommendations about that in the not too distant future.
Yeah, just to pick up on that, Patrick, of course, that we have had a call with the other Atlantic premiers and the other Atlantic medical officers of health, and we're trying our best to harmonize this as best we can, recognizing the different epidemiology and the different geographical challenges that exist for different provinces. And Dr. Fitzgerald and her team are working hard at finalizing those recommendations for healthcare workers. But I think, you can also make the prediction's not the right word, but planning for the future. You're looking into the new year and potentially whether it's a surge capacity for cases of COVID-19 or surge capacity in terms of our limitation with respect to isolating healthcare workers. Unfortunately, as much as it would kill me as a surgeon to kind of recognize that surgeries may be delayed, that may be an area where we have some flexibility looking into the new year. And these are all the decisions that leadership teams at the regional health authorities are working very hard on. They're doing a great job. They're providing an incredible service under trying times, working 24 hours a day, 7 days a week, trying to come to these decisions as this evolving situation continues.
I will now go back through each reporter to see if you have one final question. Richard Duggan of the OCM, do you have a final question?
Yes, I have several actually, but what's your guidance in regard to personal care and long-term care with this change in alert levels? Lots of people hoping to see their loved ones over the holidays, and I'm hearing from a lot of people who are expressing heartbreak to me at the thought of not being able to see those members of their family over the next couple of days.
So those discussions are happening about, what's going to be recommended, and certainly that will go out through the regional health authorities and personal care homes and associations. And, we certainly know that people who live in seniors' congregate living facilities are at a higher risk for illness and severe illness, hospitalization, and unfortunately death. So that is a vulnerable population that we really want to ensure that we protect to the greatest extent possible. We don't want to go back to where we were last year, where, or two years ago, where it was almost 2 years ago, where it was, there was no visitation. That's not where we want to be. So we're trying to find a way that we can certainly have visitation, but reduce the risk as much as possible. But I think, people have to be prepared that visitation won't be as free as what it has been up to this point. But we will, I hope, come to what strikes the best balance between, overall well-being and mental health for families and seniors, and safety with regard to COVID. Anyone who has a loved one in those, certainly we would say encourage them to get their booster shots as soon as it's available to them. And that certainly will give a measure of protection, a greater measure of protection against severe disease.
Ronelle Legros, all Newfoundland and Labrador, do you have a final question?
Yeah, perhaps a follow-up, actually, to Ricky's question there. I'm wondering what you folks are doing to keep your mental health and well-being in check. Dr. Fitzgerald, these updates, it's no, we can tell that these haven't been easy for you. What are you folks going to do over the holidays to make sure that that you enjoy as well?
You go first, Dr. Fitzgerald.
I don't know. I hope I'm going to get some time to just have some peace and quiet. But, we all have to, there's a service that has to be provided. So I'm on call over the holidays, so I'll be doing that. And, hopefully we'll get a little bit of time to be able to hunker down and just relax and spend a bit of time with family.
I think that's safe to say for all three of us. We're used to working over holidays in my previous life and Dr. Haggie's previous life. So, but in terms of keeping our mental health solid, that's been the advice that we've provided to everybody. You have to look after yourself before you can look after others, and we're doing our best. I know my family's been incredibly supportive. My wife and children have been just there at my side always, coming home in the evenings with the weight of these decisions clearly on my shoulders. And they've been incredibly supportive. And for me, it's the early morning run that helps get me through the rest of the day. Minister?
Sorry, I was on mute. The phrase of the last 2 years. I go for dog therapy. We have two lovely little dogs who are really a joy to be with. I just want to spend time at home with the family, and ideally with the phone not ringing too many times. It's very unpredictable, and as the Premier says, I can't really add much more to that. And Janice's comments. I mean, Janice has been much more involved in the operational outbreak management than either of us, but it wears on us and the family.
Jody Cook of NTV, do you have a final question?
Hi, thanks. Just on the booster shots, right now we know that the frontline workers, nurses, doctors, et cetera, they're ultimately competing with the general public to try to get their booster appointments. Is there any consideration to do booster priority to these types of groups right now?
So we recognize that, and Dr. Haggie, I don't know if you want to speak to it further, but booster campaigns are being launched in the hospital, similar to, so if you're a healthcare worker in the past, you could have gotten a flu vaccine. There's almost like a mobile clinic within the hospitals that go around vaccinating people for flu shots, and those are, as I understand it, available certainly in the metro hospitals today. But Minister, I don't know if you have anything further to add on that?
Yes, once the boosters became available for or recommended for frontline healthcare workers, I know in Central, for example, they were running clinics within the hospital itself in the way they do for the flu shots and these kind of things. And as Premier referenced, both Health Sciences and St. Clair's Mercy today will be running clinics for frontline staff.
Peter Jackson of the Telegram, do you have a final question?
Yes, I wanted to ask about boosters, and I'm wondering, when do you anticipate that the definition of fully vaccinated when it comes to vax passes and travel restrictions will actually switch to having 2 shots plus a booster?
That's a larger question.
Yeah, I don't think we have an answer for that question. Certainly, we're going to take our lead from the evidence that comes, with studies that come after booster doses, and I'm sure NACI will be looking at all that information as well to to evaluate what they consider to be a primary series of this vaccine versus, what's a booster dose and how often booster doses would be needed. So all of that information will, that's going to take some time to get. It could be, it could be 2 or 3 years before we really know that information. So, so I don't really have an answer for that question definitively.
Okay, thank you.
Terry Roberts of CBC, do you have a final question?
I do. Can you speak to the availability of, first of all, staff to administer vaccines and testing, and also the availability of the booster in the coming days? How quickly will all this flow out?
Sure, and Minister can help address this as well, but we've had discussions with the regional health authorities, and again, kudos to them and their leadership teams who have gone through an incredible 18, 20 months as well. Our understanding is that the supply is not an issue. There's been an incredible number of people who've answered the call to put the shots in arms. So people who have said that I want to help, I want to do this. There's been a great call from the NLMA, from the nurses, and all the associated healthcare workers, and there's been an overwhelming response, as I understand it. And so now it's implementing that. So supply should not be an issue. The availability of workers shouldn't be an issue. They're sorting through the exact training to ensure that people have the skills required to do that. And then, of course, the availability of space to do it isn't an issue, as we've offered whatever we can as a province to ensure that space isn't an issue. So it does take us time to kind of ramp up, and I know people are frustrated with that, but we, as early evidence, last week we were doing 1,000 doses a day, and I think on Monday we did almost 3 or more. So, presumably yesterday was more as well. All the healthcare authorities are committed to this. The minister has had conversations with them. I've had conversations with some of them, and they know that this is the direction that we want to take and the number one priority. Minister?
Thank you, Premier. I mean, on our better days with the original campaign for second shots, for example, we hit around 6,500 doses administered per day. We've set ourselves an aspirational goal to try and double that. And as the Premier referenced, we're looking at maybe expanding the pool of healthcare providers who can administer doses, or freeing up some of the public health staff from contact tracing and swabbing to allow them to go. So those are works in progress, and each of the RHAs is committed to bring that up as fast as possible. I think from the public's point of view, the challenge is that these clinics are so in demand that they actually fill up and disappear from the website almost as fast as they're put up. But we have supply for everyone, and we have the Pfizer for the younger group as well as the pediatric dose. So the boosters are there, and we're trying to set some records.
Heidi Adder of CBC Labrador, do you have a final question?
Yes, I do. Thank you for Minister, Premier. The province has previously stated there is a nursing shortage and COVID hasn't helped. However, there are multiple communities without nurses this holiday season in Labrador for more than 2 weeks, and people are concerned. What's your response to people concerned about living in a community where there's no registered nurses for more than 2 weeks this holiday season?
Certainly this is a challenge, and it's been a challenge on the coast of Labrador to varying degrees since my time with what was then Grenfell Regional Health Services. Some of those nursing stations cycling 45 RNs through 3 positions in the space of a year because they are extremely difficult to recruit for, no matter how much you put in the pot as benefits. There are arrangements for virtual care for emergencies, and I spoke with the representatives of Labrador Grenfell Health today to see what their challenges might be in terms of getting mobile teams in to do the vaccination. We're working through that. So from the point of view of vaccination, there is a plan. From the point of view of emergency cover, there is a plan. it's a challenge. There's no doubt about it.
Patrick Butler of Radio Canada, do you have a final question?
I do. Just back on this question of access to boosters and staffing decisions. Is it fair to say that public health has said, okay, right now, at this point in time, we want to make sure the focus is on swabbing people and realizing, who is infected, where our cases are, and is that the result of, is the fact that our booster clinics haven't been set up or there hasn't been as much access to booster shots, is it a direct result of that, of a decision to prioritize testing over vaccination at this point in time?
Well, before Dr. Fitzgerald can answer that for public health, we said last week, Patrick, that this would take us several days to get up and going back to where we were at summer pace and even beyond. And I think you've seen it go from 1,000 to 3,000 and now beyond, and we're hoping to accelerate even faster. The reality is that it does take time to get to where we want to go, and that's going to take us a few days. With respect to the triaging of resources and within public health, Dr. Fitzgerald?
Yes, so, we have people in public health who are specialized to do case and contact management, and then we have people who are specialized to do vaccinations. And so our goal right now is to have people who can vaccinate to be out vaccinating. And that's why I think we're putting in some of these measures as well, is to make sure that we can have them do that. So there's certainly no doubt that these cases that we've had, the counts that we've had over the last little while, have taken a lot of public health capacity. So that's why it's so important for everybody to keep their contacts as low as possible so that we can have public health doing the work that they really, that has to be done, and that will help to get us all moving forward, which is the vaccination campaign. So if we can keep our cases low, then we can have more people go towards that. Even more of a reason for us to keep our contacts low over the holiday season and beyond.
Thank you, everyone. Premier, do you have any final comments today?
Yeah, sure. Thank you all for joining us. Certainly not the news anyone wants to share the day before Tibbs Eve. I will say that we have some clarity on the exact number of Omicron. It seemed presumptive and confirmed in total is 86. And I think earlier I gave a slightly lower number. That's just to confirm that. I really want to stress a point that has come from the minister and Dr. Fitzgerald, that all the measures that we have taken have not been in vain. They have achieved deliverable goals that have been the envy of the rest of the country, while we were able to maintain some normal life, but most importantly, as Dr. Fitzgerald pointed out, saved lives. And on top of that, vaccines do work. They may not work with this variant as much as we would like them to work, but they still have a baseline efficacy that will help us get through compared to some other jurisdictions with lower rates of vaccination. Vaccines do work, and it's not the same exactly as it was in March 2020 because we have an instrument available to us that hadn't been created back in March 2020. So, we don't know where this is going to go. We do know from the evidence available to us today that it is rapidly spreading, and so we need to take these measures today, not that any of us wanted to do so. So please be kind, look after yourself and each other, and please be patient with those frontline healthcare workers and the people delivering the vaccines. Everyone is doing their best at a trying time of year, and no one wants to be in there doing that. So please be patient, be respectful, and be kind as you always have been, and we will get through this together. Thank you.
Thank you, Premier. Thank you, everyone, for joining us today. Please stay safe and enjoy the rest of your day.